My name is Dinesh Kumar. I'm Chief Operations Officer at Promaxo, and here to talk about how we are making a difference with our office-based MRI system and robotic platform. So it's a busy slide. I just want you to focus on the right side, on the numbers. So we were founded in 2016. We are based in Oakland, California, and we got our 510K in 2021. And since then, we have seen 200% year-over-year growth in our customer acquisition. And we are well on our path to profitability over the next 12 to 18 months with a clear pathway to up to 70% gross margins and more than 30% in EBITDA margins. We have a pretty sizable and defensible IP portfolio with a growing list of publications, clinical and technical, and upwards of 75% cancer detection rate, which again, compared to standard care, is way above what anything else can achieve. We operate in a pretty sizable, addressable market of $3 billion per year for prostate cancer and diagnosis. And we have sold more than 100 systems and covered more than 30 territories and states. So when we think of MRI, right, so MRI is really a gold standard for soft tissue imaging. But traditional MRIs also, when we think of they're bulky, they are in basement, you have to basically put a large infrastructure around. There is reinforcement and there is shielding and costly to acquire and maintain. As a result, there is low availability and long waiting period for patients. But also, you can't just use traditional tools under MRI. And on top of that, access to anatomy is pretty poor. And that's where we fit in at Promaxo. We want to do basically it all for prostate, from screening to biopsy to treatment and post-treatment follow-up. So for screening, we are collecting a lot of data to build machine learning-based tissue characterization. But for biopsy and targeted therapy, we are cleared now. We have an MRI system for doing manual transperineal biopsy and intervention. And the robot, transperineal robot, it's an RCM robot. We are getting ready to submit for FDA 510K. The leadership team, again, a lot of us here, but most of us have decades of experience in urology, robotics, and MR, a system led by serial entrepreneur Amit Vora. So in terms of total market size, so prostate, we see more than 1 million biopsies per year and a few 100,000 treatments. And when you combine it all, it's almost $3 billion worldwide market per year. And when we look at adjacent markets where we are already laying groundwork, for example, female pelvic floor is $4 billion, prostate screening $7 billion, and breast is $20 billion total addressable market. This is what the system looks like. So on the right side, you see our MRI system magnet, which is about 4 feet along with the panel. On the left side, you see the system with bore open and a robot that's meant to go through the bore to do transperineal intervention. The MRI system is, again, small footprint. You can actually fit it in a very small office in a urology clinic even, or ASC. And it's very patient and physician-friendly, so better outcomes, better detection rates, added reimbursements for physicians and facilities. But for patients, it's also less invasive. There's no transrectal approach for prostate. And we already have machine learning-based image enhancement and image artifact reduction built in, and really collecting data to get to tissue characterization. The robot is still pre-FDA, pre-510K. How do we compare against standard care? So standard care is really 12-core to 15-core transrectal biopsy, where you sample prostate uniformly. And we actually have been comparing at most sites. We do per lesion. We take about 2 samples per lesion and up to 4 or 5 total sample. And with that, we are getting upwards of 75% detection rates across multiple centers. And we upgrade cancer at least a third time, and we identify more clinically significant cancers. So this is a testimonial from one of our doctors and his patient.
Offering MRI targeted biopsy is a game changer. This is different than an MRI fusion biopsy. It's offered better patient care, better outcomes, and less side effects.
I was very worried going into my Promaxo MRI biopsy because I had a traditional biopsy before. The recovery from that took a very long time. It was very unpleasant, and the procedure itself was extremely stressful.
We can accurately look and find the cancers without any transrectal ultrasound or probe.
My Promaxo MRI biopsy gave the doctor exactly what we needed to know to determine my course of treatment. There's just not enough words to describe how much easier and how much less impactful the Promaxo procedure is.
Promaxo has enabled me to run clinic and perform biopsies at the same time. Before I was running to the ASC to do my biopsies. Now I can bring it all in-house. And for patients, that makes the experience so much more easier. This is a technology that is eons ahead of what we have here in our community. And bringing this on board has really set us apart from the other practices around us. I imagine in the future, we're going to be using this machine for so many different things in our offices. We're just at the tip of the iceberg.
My Promaxo MRI procedure was so easy and so much less invasive. My recovery time was just days. I had no complications whatsoever. I came out very, very happy.
Dr. Mayan is not alone, right? So across the board, many other urologists and key opinion leaders, they have had similar experiences. They come from academic sites and also from research and private clinics. This is a very busy slide, and that's why it's kind of more exciting for us as well, because this is our product roadmap. We want to see it busy. So we have already realized the prostate MRI, so we can do prostate biopsy and target treatment. But in clinical and in research, we are getting to prostate screening through data collection and tissue characterization, female pelvic floor, OBGYN indications, and kidney and breast following that. So our robot is pre-510K, so we expect clearance by either end of this year or early next year. So a collection of our, some of basically our users, so they cover entire market segment for us. So we go from a urologist's office to IDNs and ASCs, but also research centers and university. And some of these customers have actually bought multiple systems as well. We are growing pretty rapidly. Green is where our current presence is. That includes clinical systems. Blue is where we want to be this year, and we already have been laying groundwork, and some have already been realized. And orange is where we want to go in 2025. So production capacity is it's reaching up to 120 per year. So that's really where we want to be by end of this year, so that we can fulfill our demand. But also laying groundwork internationally to optimize our supply chain, but also to basically meet demand in international markets. And this is actually a picture of our contract manufacturer where we build the systems. So I will stop with these highlights. I will let you read these. I talked about all of these, but what I'm here for is we are really finishing up closing our B3 round in anticipation of a big round. And if there is any interest in participating in B3, then please come and find me. We can do one-on-one and we can go over more details. Thank you.